क्या वो महेंद्र शुरू हुआ? हेलो। लाइव है तो ठीक है, फिर बंद करता हूँ ना। Good evening, everyone. Today we'll discuss a few questions from dental anatomy. Right, and same as yesterday, we'll have some questions where only one option is correct, and some questions where multiple options are correct, and then we'll have some match the following type and a couple of picture based questions. So let's start with the first question. Which of the following factors can influence the timing and pattern of tooth eruption? So timing and pattern of tooth eruption, right? Options are genetics, nutritional status, hormonal imbalance, and oral hygiene. So as we have studied in class as well, the eruption or shedding, they are largely controlled by genetics and they are influenced by environmental factors. Right, they are influenced by environmental factors. So genetics definitely has the major role. Then nutrition and hormonal imbalance, they are all involved except for oral hygiene. Oral hygiene does not have any role in the eruption of the tooth, right? So let's go to the next question. So next question is, arrange the following primary teeth in typical sequence of eruption. So what is the sequence of eruption of the primary teeth? So can you tell me what is the sequence of the primary eruption of the primary teeth? Which tooth erupts? Which is the first primary tooth to erupt? It is the central incisor, isn't it? It is the central incisor. Followed by which tooth erupts after central incisor? Lateral incisor. Then you will have the first molar, then canine, and finally the second molar, right? Is this the correct sequence or do we need to change something? Right, so the central incisor, then lateral incisor, then first molar, and then canine, right? So what would be the correct sequence? It would be option A. Yes, mandibular, central, then lateral, then first molar, and then canine. Since here we have a mixture of mandibular and maxillary teeth, overall what happens is the anterior teeth will erupt before the posterior teeth, right? That is, the incisors will erupt before the posteriors. So first the incisors will erupt, all the four incisors, then the first molars, both the first molars, maxillary and mandibular, and then both the canines, maxillary and mandibular, and finally both the second molars, maxillary and mandibular. So whether maxillary or mandibular, it doesn't matter. What matters is that central incisor followed by lateral, followed by first molar, and then finally the canine, and after canine second primary molar, right? So that's the sequence of eruption. Which is the largest cusp on primary mandibular first molar? So primary mandibular first molar, which is the largest cusp. So more or less this is an atypical, tooth, isn't it? The mesial marginal ridge is quite large. It even resembles like a cusp. So which amongst all these is the largest cusp on the mandibular first primary molar? Which other typical feature do we notice here? It even has a straight mesial outline. So which cusp do you think is the largest? Okay, let me tell you, in all the primary first molar, that is the maxillary and the mandibular primary first molar, it is the mesial half that is well defined as compared to the distal half. So obviously it has to be either the mesiobuccal or the mesiolingual cusp. Now which amongst these two is the largest cusp? It also is the sharpest cusp, right? Let me give you a hint that the largest cusp is also the sharpest, right? The largest is also the sharpest. So can you tell me which cusp is this? Is it the mesiobuccal or the mesiolingual? And the answer would be mesiolingual, right? The answer would be mesiolingual. Mesiolingual is the sharpest cusp. Now there is a general rule that you can go along with for the sharper cusp, for the prominent cusps, not for the largest cusp, just for the cusp which is sharper. So the rule is that the guiding cusp is sharper as compared to the supporting cusp, right? And in case of mandibular teeth, which is the guiding cusp? It is the lingual cusp that is the guiding, and the supporting cusps are buccal cusps. So anyway, buccal cusp would be less prominent as compared to the lingual cusp. It would be blunt, it would be flatter as compared to the lingual cusp. So lingual cusp is sharper and it is larger in the mandibular first molar. In case of maxillary first molar, it would be mesiobuccal cusp, right? In case of maxillary first primary molar, it would be mesiobuccal cusp, which will be the largest and the sharpest cusp. Is it clear? And for the second molars, both maxillary and mandibular primary second molars, the sequence is more or less same as the permanent teeth, right? So same as permanent maxillary first molar, the mesiopalatal of upper E will be largest, and same as mandibular first permanent molar, it will be mesiobuccal, that is the largest in lower second primary molar, right? So let's go to the next question. Which of the following are characteristic feature of primary teeth compared to permanent teeth? So primary and permanent teeth, which are the characteristic features that differentiate them, right? Option A, thinner enamel. So does the primary tooth have a thinner enamel as compared to permanent enamel? And the answer is yes. It has an overall thickness of approximately 1.5 mm, whereas permanent has a maximum thickness of 2.5 mm, right? So yes, it is thinner, whiter in appearance. Then yes, primary are more opaque. Primary enamel is more opaque. So the underlying dentine is not as visible as in case of permanent enamel, isn't it? They are translucent, isn't it? So dentine is more visible in the permanent teeth, and that's why the primary teeth, they are whiter in comparison to the permanent teeth. Option C is shorter root. Now when you look at the tooth, let's say this is the primary tooth and here is the permanent tooth. Now, what difference do you notice? That relatively, when you compare the crown to the root, you will notice that the relative length of root is longer in the primary, isn't it? The relative length of root is longer in primary as compared to the permanent. We are not talking in the absolute terms, isn't it? We are not talking in the absolute terms. Millimeters में हम बात नहीं कर रहे हैं, जो उसका dimension है उसमें बात नहीं कर रहे हैं. We are talking about the relative length. So when you compare its length to the crown, you will notice that the roots in primaries are longer as compared to the permanent. And unless otherwise mentioned, you will always consider it as a relative measurement, right? So roots in the primary are longer in comparison to the crown. Clear? Option D, more pronounced spur horns. Again, when you look at the primary teeth, you will notice we have already discussed that the enamel is of uniform thickness and it is thin, isn't it, at 1.5 millimeters. The dentine is also thin, isn't it? The dentine is also thin, and when the dentine is thin, the pulp horns, isn't it? The pulp horns will be higher, isn't it? The distance between the surface and the pulp horn would be less. So the pulp horn are higher in primary as compared to the permanent. In permanent, we have a thicker enamel layer, then we have a thicker dentine layer. So the pulp horns are relatively lower in comparison to the primary, isn't it? So option D is also correct. Is it clear? Is it clear? समझ में आ रहा है? So let's go to the next question. Which tooth or which type of tooth would most likely leave a large rectangular mark in the bite? So this is the question from forensic dentistry. तो ये forensic का question हो गया, right? And what they want to know is which of these teeth will leave a large rectangular mark in a bite mark, right? So lateral incisor, first molar, central incisor and canine. We have these four options. So what happens is the maxillary central incisor, it has a broad incisor ledge, isn't it? It has a broad incisor ledge. So it will leave a large rectangular mark. It is the widest mesiolingually, it is the widest anterior tooth, isn't it? And that is why its incisal mark on the skin would be a wide rectangle. Now the maxillary lateral incisor and mandibular central and lateral incisor, they will form small rectangle, isn't it? They will form small rectangle as compared to the maxillary central incisor. What about the cuspids? Cuspids will either lead to formation of a point or a triangle. So point to कब? When there is a sharp cusp, and triangle when the cusp tip is worn out, isn't it? When the cusp tip is worn out, it will form a triangle. Similarly, premolars, maxillary premolars. So let's say upper 4 and 5, also lower 5. So if the lower 5 is a 2 cusp form, right? If it is a 2 cusp form, it will form a figure of 8 pattern. Figure of 8 pattern, because both the buccal and lingual cusps would be seen, isn't it? Lower first premolar, same as the canines, it will form either a point or a triangle, because the lingual cusp The lingual cusp is rudimentary, or you can say underdeveloped. It resembles a cingulum, isn't it? The lingual cusp of the lower first premolar resembles a cingulum, and that is why it won't be seen on the bite mark. तो यहाँ पर भी कैसा होगा, एक पॉइंट जैसे कि कनाइन के ऊपर आता है, and then we are left with the molars. So molars are usually not seen on a bite mark. इतना बड़ा मुंह हमारा नहीं खुलता कि हम molars तक ही बाइट कर सकें किसी को, ठीक है? So let's go to the next question. क्या आपको ये सब समझ में आ रहा है? Yes, भावना, the option C is correct. That is the central incisor, right? So let's go to the next question. A forensic dentist is asked to estimate the age of a skeletal remain. Radiographs show unerupted third molars, and the roots of all other permanent teeth are fully formed. What is the most likely age range of this individual? So age range क्या होगी of this individual, right? Options are 6 to 8 years, 12 to 14 years, 18 to 20 years and 25 to 30 years. तो मुझे लगता है कि ये क्वेश्चन तो आसान है थोड़ा, है ना? You can answer it. तो would you like to attempt it? आप लोग अटेम्प्ट करना चाहोगे कि इसकी एज रेंज क्या होगी? हमारे पास नेसेसरी इंफॉर्मेशन है कि रेडियोग्राफ्स देखा तो हमें क्या मिला, थर्ड मोलर मिल गया हमें उसमें अनरप्टेड, एंड द रूट्स ऑफ ऑल दी अदर परमानेंट टीथ आर फुली फॉर्म्ड. सो व्हाट इज द मोस्ट लाइकली एज रेंज ऑफ द इंडिविजुअल? तो कैसे कैलकुलेट करेंगे? What are the two important informations that we have here? जो दो इंपॉर्टेंट इंफॉर्मेशन हैं वो क्या है यहाँ पर? वेरी गुड भावना, है ना? ऑप्शन सी, वेरी गुड सबिहा, ठीक है ना? दोनों, आप दोनों ने ही सही आंसर दिया है. ये हमें कैसे पता चला? बिकॉज वी हैव टू वेरी इंपॉर्टेंट इंफॉर्मेशन हियर, दैट द थर्ड मोलर, isn't it? Third molar, be it maxillary or mandibular, right? It is formed and it is unerupted, right? यहाँ पर क्या लिखा हुआ है? It shows unerupted third molar. That means it has formed. It's just that it is within the bone. It has not yet erupted, right? Plus the roots of all the teeth are complete. That means these third molars are impacted and the age of their eruption is almost past, isn't it? So eruption age क्या है इनकी third molars की? 17 to 21 years. So obviously this has to be the age range of this individual, isn't it? So 17 to 21 को जब आप देखोगे, it is the option C which closely coincides with this age range, isn't it? Yes, second molar erupts at 13 years of age. Plus 3 equals to 16 years, isn't it? तो 16 years भी अगर हम करेंगे तो हम इससे पीछे छूट जाएंगे, right? अगर हम यहाँ पर एक और एज रेंज डाल देते 15 to 17, then it would have been confusing for you, right? So along with the completed roots, the other important information here is the presence of third molars within the bone. तो third molars भी तो present है ना bone के अंदर. They are not erupted. Shows unerupted. It shows unerupted third molar. Unerupted third molar दिख रहा है वहां पर, राइट? मतलब थर्ड मोलर बन गया है, तो वो हमें दिख रहा है वहां पर, राइट? इसीलिए हम इसकी जो एज रेंज लेंगे, दैट वुड बी क्लोज टू द इरप्शन एज ऑफ द थर्ड मोलर्स, राइट? ठीक है भावना? तो कभी कभी गड़बड़ हो सकती है ना? क्या आपको इसकी क्रोनोलॉजी याद है क्या? डू यू रिमेंबर द क्रोनोलॉजी ऑफ परमानेंट एंड प्राइमरी टीथ? अगर हम परमानेंट से भी स्टार्ट करें तो डू यू रिमेंबर द क्रोनोलॉजी? कैन यू टेल मी विच टीथ इनिशिएट in the first year after birth? Can you tell me which teeth initiate in the first year after birth? पैदा होने के बाद पहले साल में कौन कौन से टीथ हैं जो कि इनिशिएट होते हैं, राइट? आई एम नॉट टॉकिंग अबाउट कंप्लीशन, आई एम टॉकिंग अबाउट इनिशिएशन, राइट? सो विच टीथ इनिशिएट इन द फर्स्ट ईयर ऑफ द लाइफ? तो इसका आंसर क्या होगा? फर्स्ट मोलर्स, राइट? एंड ऑल दी anteriors, right? Central incisor, lateral incisor and canines, they all initiate in the first year of life. So can you tell me which teeth will initiate in the second year of life? Second year of life में कौन से teeth initiate होते हैं? Only the first Only the first premolars, isn't it? Only the first premolars initiate in the second year of life. In the third year के फर्स्ट हाफ में very good भावना है ना, incisors, first molar and canines, right? Canines also initiate in the first year of life. Canines also initiate in the first year of life. So third year के first half में, that is 2 to 2.5 years में, तो क्या initiate होगा? Second premolar, और second half में कौन initiate होगा? Second molar, right? So almost all the permanent teeth are initiated within the first 3 years of the life. Very good भावना है ना. Second premolar in the first half of the third year and second molar in the second half of the second year. So 2.5 to 3 years में तो second molar, 2 to 2.5 years में second premolar. इसी तरीके से अगर हम crown completion की बात करें तो crown completion कब होगा? Can you tell me when will the crown completion take place? crown completion कब होगा? कोई बता सकता है? थोड़ा साइड में आ जाते हैं. Crown completion. So which tooth? Yes बेटा, canine initiate पहले ही होगा ना. फर्स्ट ईयर में तो initiate होगा canine. In fact, it's the upper lateral incisor amongst the anteriors which initiates the last, right? 3 to 4 months पे upper central incisor, lower central incisor, lower lateral incisor. 4 to 5 months पे upper and lower canines initiate होते हैं. This is about initiation, क्योंकि आपने पूछा ना इसीलिए. और फिर उसके बाद जो upper lateral incisor है, that initiates at about 10 to 12 months, isn't it? So the upper lateral incisor is the last anterior tooth to initiate, isn't it? It is the last anterior tooth to initiate. तो भावना कह रही है eruption age में से 3 साल माइनस कर दो. ये भी एक अच्छा तरीका है. तो upper and lower first molars crown completion will take place at around 2 to 3 years of age, isn't it? 2 to 3 years of age, and this is the same time when the second molar initiates. अभी हमने देखा second half of the third year, so 2 to 3 years roughly अपन ऐसा कह सकते हैं, right? After that, after the first molars, which teeth will complete? It will be anteriors, isn't it? So anteriors may be incisors or canine. Canine, remember, are the larger teeth, isn't it? They are the larger teeth, and incisors are the smaller teeth. So which will complete first? It will be the incisors, right? So let me just write I for incisors. Incisors will complete at around 4 to 5 years of age, isn't it? Now what will happen next? After incisors, which teeth will complete? Will it be the canines or will it be the premolars? And if it will be the premolars, then which one? First or second or both? Incisors के बाद कौन से teeth complete होंगे? Incisors के बाद first premolars complete होंगे at the age of around 5 to 6 years. Then at the age of around 6 to 7 years, second premolars and canines will be completed, right? So so the canines initiate before the premolars, but they will complete after the premolars. Is it clear? Because canines are the larger teeth in comparison to the premolars or the incisors. So first molar complete हो ही चुका है. Second molar कब complete होगा? Approximately 8 to 9 years में, right? So this is the crown completion date. Yes, first premolar in the during 5th to 6th year, and then second premolar and canine 6 to 7 years, right? Then you all remember the eruption age. तो eruption age का भी रिवीजन कर लेते हैं एक बार, if it is not a problem, ठीक है ना? eruption age का रिवीजन कर लेते हैं एक बार, right? तो सबसे पहले कौन सा टीथ erupt होगा? सबसे पहले upper and lower 6 along with the lower central incisor at the age of 6 to 7 years, isn't it? Upper and lower molars along with the lower central incisor at the age of 6 to 7 years. Then upper central, lower lateral at the age of 7 to 8 years. Then upper lateral at the age of 8 to 9 years. ठीक है? Is it clear? After that, the remaining deciduous will be replaced by the succedaneous teeth. So canines and premolars will replace the canine and the primary molars. So as you can see that the maxillary teeth precede the mandibular teeth, यानी कि mandibular teeth पहले erupt होते हैं और उसके ही सक्सेसिव उसी के consecutive teeth जो maxillary हैं they will erupt later on. So पहले central mandibular, then maxillary central, then mandibular lateral, and then maxillary lateral. So maxillary teeth will erupt after their mandibular counterparts. But अभी जो later half है इसके अंदर condition reverse हो जाती है. यहाँ पर क्या होगा, जो maxillary teeth हैं they will erupt before their mandibular counterparts. So what happens is after the lateral incisor, the lower canine will erupt at an age of around 9 to 10 years. After the lower canine, upper first premolar will erupt at the age of, and all of this will happen in the age range of 9 to 12 years, right? So 9 to 10 पे lower canine erupt हुआ, 10 to 11 पे upper first premolar erupt हुआ. After that, lower first premolar and upper second premolar they will erupt at an age of about 10 to 12 years. तो बहुत ज्यादा एज रेंज में डिफरेंस नहीं, बट यू नीड टू रिमेंबर दी सीक्वेंस. तो पहले अपर फर्स्ट प्रीमोलर, देन लोअर फर्स्ट प्रीमोलर, then upper second premolar, and then lower second premolar along with the upper canine. They will erupt at an age of 11 to 12 years, right? तो एज रेंज बहुत dubious सी है, पास है, बहुत ज्यादा डिफरेंस नहीं है एज रेंज में, कुछ महीनों का ही फर्क है, बट सीक्वेंस इज इंपॉर्टेंट, राइट? लोअर canine, then upper first premolar, then lower first premolar, then upper second premolar, then lower second premolar, and then finally the upper canine. Is it clear? And finally the second molars, they will erupt at an age of around 13 years, and then the third molars which will erupt at an age of around 17 to 21 years. Clear? ठीक है? For root completion you will just need to add 2 to 3 years to these eruption dates, right? So let's go to the next question. Which of the following are key purposes of proper contact area? Proper contact area. So let's say this is a premolar and this is the adjacent premolar. So these are the contact areas, right? So what is the key purpose of the proper contact area between adjacent teeth? तो adjacent teeth के बीच में proper contact area होगा तो उससे हमें क्या फायदा है या उसका क्या पर्पस है? लोअर में 10 to 12 फॉर बोथ फर्स्ट एंड सेकंड प्रीमोलर. ऐसा नहीं है बेटा, लोअर में अगर दोनों का ही एज रेंज सेम होगा तो फिर हमें पता कैसे चलेगा? तो लोअर फर्स्ट प्रीमोलर 10 to 12, 10 to 11, एंड देन सेकंड प्रीमोलर अराउंड 11 to 12 कह लो या 10 to 12 कह लो. अभी हमने क्या लिखा है उधर देखो, लोअर सेकंड प्रीमोलर 11 to 12, लोअर फर्स्ट प्रीमोलर 10 to 12, राइट? अपर फर्स्ट प्रीमोलर इज ड्यूरिंग 10 to 11 years of age, राइट? तो एज रेंज बहुत क्लोज है, बट एज रेंज से ज्यादा इंपॉर्टेंट है सीक्वेंस. तो मुझे नहीं लगता कि ये मोलर प्री मोलर जो है अपर एंड लोअर प्री मोलर, इनकी एज रेंज पे कोई ऐसे बहुत ज्यादा सवाल पूछेंगे आपसे, बट सीक्वेंस जो है दैट इज इंपॉर्टेंट. सीक्वेंस पे सवाल पूछ सकते हैं कि विच ऑफ दीज टीथ विल इरप्ट फर्स्ट, या यूं पूछ सकते हैं कि ऑल दी मैंडिबुलर टीथ इरप्ट बिफोर देयर मैक्सिलरी काउंटर पार्ट्स, विच आर दी एक्सेप्शन, देन एक्सेप्शन वुड बी प्रीमोलर्स. ठीक है? तो इस तरीके से आपसे सवाल पूछ सकते हैं. I don't think they will ask such confusing questions, है ना, जिसमें आपको एज रेंज जो इतनी क्लोज है उसमें आपसे सवाल पूछे. So which of the following are the key purposes for proper contact area between adjacent teeth? Options are they prevent food impaction, option B stabilizing dental arches, option C enhancing tooth development, and D is increasing masticatory force. So do you think this contact, the contact between two teeth, will have anything to do with their development or force of mastication? Do you think this contact will have anything to do with the development or the force of mastication? Answer would be no, isn't it? इन वन एमसीक्यू, एक एमसीक्यू के अंदर ऑप्शंस बहुत क्लोज थे। तो एक्चुअली प्रॉब्लम वही है कि एमसीक्यू अगर आएगा तो उसके अंदर ऑप्शंस क्लोज ही होंगे, इजंट इट। और जैसा कि मैंने अभी अभी आपको टेबल में बताया, 10 to 11 फॉर अपर फर्स्ट प्रीमोलर, देन 11 to 12 या 10 to 12 जो था लोअर फर्स्ट प्रीमोलर, एंड 11 to 12 फॉर लोअर सेकेंड प्रीमोलर। तो इस तरीके से आप थोड़ा बहुत याद रख सकते हो। तो एज रेंज बेसिकली वही है सेम, 10 to 12 के बीच में सारे प्रीमोलर्स आ रहे हैं, राइट। सो ड्यूरिंग दोज 2 years ऑल द प्रीमोलर्स आर erupting 10 to 12 years ऑफ एज, राइट। पर उसमें जो उसके अंदर डिफरेंस है एज के अंदर, दैट इज वेरी लेस। तो इसीलिए हम ये एग्जैक्टली नहीं कह सकते कि कौन सा वाला कब इरप्ट हो रहा है। इनफैक्ट अगर आप प्रैक्टिकली देखोगे तो मोर और लेस इन द 12th ईयर ऑल दीज प्रीमोलर्स आर इरप्टिंग, राइट। ए बी एंड डी, इंक्रीजिंग मेस्टिकेटरी फोर्स। नहीं भावना, जैसे कि मैंने अभी अभी यहाँ पर बताया, बोथ सी एंड डी will have nothing to do with the contact area, ठीक है। masticatori force contact से कोई इंक्रीज नहीं होता है, दो दांतों के बीच का कॉन्टैक्ट है, ये एक प्रीमोलर है, ये दूसरा प्रीमोलर है, इनके बीच में अगर कॉन्टैक्ट हो चाहे नहीं हो, they will exert the same masticatory force, isn't it? So only the options A and B, these are the correct ones. So option A and B, these are your correct answers. तो कॉन्टैक्ट एरियाज क्या करेंगे, ये आर्च को स्टेबलाइज करके रखेंगे, isn't it? ये टीथ है आपके, so they will be stabilized if there is a proper contact between them, isn't it? Otherwise क्या होगा, बीच में से एक टूथ गायब होते ही, जैसे बीच में से एक टूथ गायब हुआ तो क्या होगा, जो पोस्टीरियर टूथ है इट विल ट्राई टू मूव मीजियली एंड द एंटीरियर टूथ विल ट्राई टू मूव डिस्टली। ऑल्सो the tooth in the opposing arch, it will try to erupt into this space, isn't it? So all these teeth, they will destabilize, isn't it? So stabilizing the dental arch, that is a very important function, and preventing food impaction, that we all know. If there is a attrition or abrasion in the proximal area and there is a small opening in the proximal area such as is here, तो यहाँ पर क्या होगा, फाइबर्स और बाकी सारा फूड इम्पैक्शन, फूड इम्पिंजमेंट यहाँ पर होने लग जाएगा, राइट। So let's go to the next question. What is the difference between the incisal ridge and incisal edge of a maxillary central incisor? तो यहाँ maxillary central incisor लिखा हो या कोई सा भी और anterior लिखा हो, be it maxillary central or mandibular central or any other incisor, in simple terms incisor, ठीक है, be it any incisor. So what is the difference between the incisal ridge and incisal edge of an incisor? Options are: the incisal ridge forms after wear and the incisal edge is present at eruption. Option B, incisal ridge is rounded part and the incisal edge is the flat portion. Incisal ridge is round when newly erupted and then incisal edge forms after wear. So basically C and A are visually opposing options, isn't it? The incisal edge is located on the lingual surface while the incisal ridge is on the labial surface. तो ये तो गलत ही हो गया, right? So basically we can rule out option B as well. So we just have to choose one from the option A and C, right? The incisal ridge forms after wear and incisal edge is present at eruption according to option A and exactly opposite according to option C. So ridge राउंड है या फ्लैट है, इसी तरीके से एज राउंड है या फ्लैट है, सी आर फॉर आर, वेरी गुड, है ना। ये भी अच्छा तरीका है याद करने का, रिज इज राउंड, isn't it? Ridge is round. So mamelons will be seen on incisal ridge, right? And edge is sharp. Edge is sharp. It is sharp. You can say it is flat, and it forms after the ridge is worn out, right? After the ridge is worn out. So once the ridge is worn out, the edge will form. So option C is the correct answer. The image below shows the mesial aspect of maxillary central incisor. Which curvature is more pronounced on this surface compared to other teeth? So which curvature is more pronounced compared to any other tooth, compared to any other tooth. तो कोई सा भी और दांत ले लो आप, जितने भी 16 तरीके के दांत हैं, उन सब में से कौन सा कर्वेचर है जो इस टूथ पर ही सबसे ज्यादा prominent है, which is that curvature. So you have only limited curvatures here, right? Buccal curvature, this is the buccal curvature. Lingual curvature, this is the lingual curvature. And here, then the cervical line curvature. So this is the curvature of the cervical line. And then the incisal curvature. Incisal curvature जैसा तो कुछ है नहीं, but if you want, you can take this curvature as the incisal curvature, right? So which amongst these four curvatures is most prominent on maxillary central incisor compared to any other tooth in the human dentition, right? तो ह्यूमन डेंटिशन मैंने अपनी तरफ से जोड़ दिया यहाँ पर, क्योंकि यहाँ पर इन्होंने वैसे लिख दिया ना कंपेयर टू दी अदर टीथ, तो अदर टीथ का मतलब ही ये है कि ऑल दी अदर टीथ. सो विच कर्वेचर इज मोस्ट प्रोमिनेंट? इट इज दी cervical curvature, right? This is the cervical curvature, and cervical curvature on the mesial side of maxillary central incisor is most prominent, and this depth is approximately 3 millimeters, right? This curvature is approximately 3 millimeters. So this is the maximum on maxillary central incisor, the cervical curvature on the mesial surface of the maxillary central incisor, right? So the answer here would be option C. Let's go to the next question. Which of the following are typical characteristics? सिंगुलम बड़ा है, पर क्या ये कनाइन से भी बड़ा है क्या? क्या ये मैक्सिलरी कनाइन से बड़ा है क्या? Is the cingulum of central incisor larger than the maxillary canine? Is the cingulum of maxillary central incisor larger than the maxillary canine? भावना, तुम मेरे सवाल का जवाब दो, तुम्हारे सवाल का जवाब अपने आप मिल जाएगा. Which is the largest cingulum in the human dentition? Is it the maxillary central incisor or the maxillary canine? So which of the following are typical characteristics of mandibular incisors? It's the maxillary canine, isn't it? Maxillary canine cingulum is larger than that of maxillary central incisor. In fact, the cingulum of upper canine is largest. It is the largest cingulum. So the lingual surface would be most prominent on the upper canine, not on the upper central or lateral incisor. So which of the following is a typical characteristic of mandibular incisor? Select all that apply. That means more than one options can be correct here, right? तो मैंडिबुलर इंसाइजर्स का हमें कैरेक्टरिस्टिक देखना है. स्मॉलर मेसोडिस्टल डायमेंशन देन मैक्सिलरी इंसाइजर्स. सो मैक्सिलरी इंसाइजर्स, as I have told you, the maxillary central incisor has the widest mesodistal dimension. So obviously option A seems to be correct. Then option B, smooth labial surface with few developmental grooves. Again, the mandibular incisors, they have a very smooth labial surface. Their labial surface is very smooth. So option B is also correct. Option C is more prominent cingulum. So cingulums are more prominent on the maxillary incisors as compared to the mandibular incisors. And option D is symmetrical crown shape. So what do you say? Do the mandibular incisors have a more symmetrical crown shapes as compared to the maxillary incisors? Do you think that the mandibular central incisor is the most symmetrical crown? The mandibular central incisor is the most symmetrical crown. Do you think this statement is correct? That the mandibular central incisor has the most symmetrical crown. This statement is correct, isn't it? In fact, the mandibular lateral incisor, it has a slight distal tilt of the incisor lateral, or you can say it has a slight distal tilt of the crown. The crown is slightly twisted on its axis, right? Apart from that, the crown more or less appears symmetrical. So as compared to the maxillary incisors, the mandibular incisors have a more symmetrical crown, isn't it? They have a more symmetrical crown. So options that are correct would be all A, B and D. So except for C, all are correct. Clear? So let's go to the next question. Can you tell me which, हम यहाँ symmetry की बात कर रहे हैं, तो can you tell me which is the most symmetrical molar? Which is the most symmetrical molar? So we talked about the most symmetrical tooth, that is the mandibular central incisor. Now can you tell me which is the most symmetrical molar? And when we are at it, can you tell me which is the most symmetrical premolar? तो दोनों क्वेश्चंस के बारे में सोचो, और आज की क्लास खत्म होने से पहले अगर तुम्हारे पास जवाब हो तो देना, नहीं तो फिर मैं बताऊंगा, राइट? So which of the following features help differentiate mandibular lateral incisors from mandibular central incisors? Now you have to differentiate between central and lateral. तो हमें फीचर्स देखने हैं किसके? lateral incisor के. Which of the following features help differentiate mandibular lateral incisor from the mandibular central incisor? So lateral incisors have a wider crown mesiodistally. Lateral incisors are more symmetrical. Lateral incisors have a more twisted incisal edge, and lateral incisors have shorter root. So which of these options do you think are correct, and they correctly describe the difference between the lateral and the central incisors? So option A क्या कह रहा है? Lateral incisor has a wider crown mesiodistally. So do you think the central incisor, the mandibular central incisor, is the smallest permanent tooth? Do you think mandibular central incisor is the smallest permanent tooth? ये statement सही है क्या? Do you think it is the smallest permanent tooth? Yes, it is the smallest permanent tooth. So obviously the lower lateral is wider than lower central. So option A is correct, isn't it? What about the option B? Lateral incisors are more symmetrical. So we have just discussed this point in the previous question, isn't it? Central incisors are the most symmetrical. So option B is incorrect. Option C says lateral incisors have a more twisted incisal edge. That too we have discussed in the previous question. That lateral incisors are twisted on their axis, so that their incisal edge seems to bend distally, isn't it? अगर central incisor ऐसा है, तो lateral incisor थोड़ा सा distally bend है. ये mesial, ये distal. So its incisal edge appears to bend distally, or the crown appears to twist distally, isn't it? So option C is also correct. Option D says lateral incisors have a shorter root. This again is false, as central incisor we have just discussed is the smallest tooth. So the root also is smaller as compared to the lateral incisor. Clear? So both options A and C are correct. आगे बढ़े. What is the primary function of canine guidance in occlusion? So there are two types of guidance. एक तो canine guidance जिसमें बता ही दिया, दूसरा group function. So what is the difference between the two? When you make a lateral excursion, right? When you move your mandible laterally towards left or right, if the posteriors are disoccluded, right? If the posteriors, all the posteriors are disoccluded, and the contact is between just the upper and lower canines, right? If the contact is between just upper and lower canines, and all the posterior teeth are disoccluded, right? They are all disoccluded, then this is canine guidance. But if along with canine, all the posterior teeth are in contact, then it is a group function, isn't it? So what do you think from this diagram can be a primary function of canine guided occlusion? Stabilizing the anterior teeth during speech. So during speech मुझे नहीं लगता कि कोई भी ऐसा जबड़ा अपना left right ला करके बात करता होगा, right? So this option is false. Option B, preventing excessive wear on posterior teeth during lateral movements. So as we just saw in these diagrams, that during lateral excursion, the posteriors are out of contact in canine guidance, isn't it? So yes, it does prevent posterior teeth during lateral excursion from excessive wear. तो ये ऑप्शन सही डिस्क्रिप्शन है, बट देख लेते हैं आगे कोई और बेहतर ऑप्शन है क्या. Aiding in the formation of proper dental arch, this is false. Canine guidance has nothing to do with the formation of arch. Protecting the TMJ during protrusion, again it has nothing to do with protrusion because canine guidance comes into play during lateral excursion. So option B is the correct answer, isn't it? Option B is the correct answer. तो क्लिनिकल एप्लीकेशन आपने कभी कभी एंडो में या प्रोस्थो में देखी होगी. वहां पर आपसे कई बार पूछते हैं कि if an implant is given on the first premolar or the first molar region, an implant is given in the first molar or a first premolar region, then which type of guidance would you like to have minimum damaging forces on your implant or on your FPD? तो आंसर क्या होगा? We would like to have a canine guided occlusion. So we would like to keep this prosthesis a bit infra-occlusion. ठीक है ना, occlusion से थोड़ा छोटा, हम इसके जो cusps हैं उनको थोड़ा सा prominent कम रखना चाहेंगे. We would like to have them less prominent so that they do not interfere, they do not contact during the lateral movement, because lateral forces are the most damaging forces. Lateral forces कैसे होते हैं? These are the most damaging forces, isn't it? So if you have given a prosthesis, be it a FPD or an implant in the posterior region, you would like to have a canine guided occlusion to minimize the lateral forces on your prosthesis. Is it clear? So let's go to the next question. At what age do the maxillary canines typically erupt? तो maxillary canines typically कब erupt होंगे? ये हमने अभी थोड़ी देर पहले जब हम डिस्कस कर रहे थे. बेटा एक्सेंट्रिक में तो वैसे कोई सा भी कॉन्टैक्ट नहीं होता है, ना कनाइन का ना कोई और. अगर मेरे पे भरोसा ना हो तो करके देखो. एंड एक्चुअली द वर्ड यूज इज इनकरेक्ट. एक्सेंट्रिक नहीं, आपको बैलेंसिंग बोलना चाहिए तो ना. देयर इज नो कॉन्टैक्ट इन दी बैलेंसिंग साइड, but there is a contact in the lateral movement, and both these are eccentric movement along with the protrusive movement, isn't it? तो अगर eccentric में कोई contact ही नहीं होगा तो फिर कैसे काम चलेगा? contact तो होगा ही होगा. lateral excursion में contact होगा ही होगा, right? So no contact during eccentric movement is sort of a wrong statement, isn't it? eccentric movement में contact तो होगा ही होगा. आप जो कहना चाह रहे हो वो आप बैलेंसिंग साइड की बात करना चाह रहे हो मोस्ट प्रोबेबली. सो बैलेंसिंग साइड में कोई कॉन्टैक्ट नहीं होता नेचुरल डेंटिशन के अंदर, इजंट इट? बट वी आर नॉट कंसर्न विद द बैलेंसिंग साइड, वी आर कंसर्न विद द लैटरल मूवमेंट, क्योंकि लैटरल मूवमेंट में कॉन्टैक्ट्स है, वहां मिनिमाइज करना है. तो वहां कैसे मिनिमाइज करेंगे? अगर पोस्टीरियस में दिया है प्रोस्थेसिस तो आप उसको फिर आप कनाइन गाइडेड ओक्लूजन बनाओगे. अगर बैलेंसिंग साइड की अगर हम बात करते हैं, इफ देयर इज एनी कॉन्टैक्ट इवन इन द नेचुरल टीथ, then this contact has to be removed. This contact has to be removed क्योंकि balancing side में dental contact in natural dentition is also damaging. ठीक है, तो हम नहीं चाहते कि आज दांत हैं कल दांत ना रहे मुंह के अंदर, राइट? तो इसलिए बैलेंसिंग साइड में कॉन्टैक्ट होने ही नहीं चाहिए इन नेचुरल डेंटिशन. बट इन कंप्लीट डेंचर और डिस्टल एक्सटेंशन प्रोस्थेसिस यू डू नीड अ बैलेंसिंग साइड कॉन्टैक्ट, इजंट इट? तो वो डिपेंड करता है कि आपको कैसा कंडीशन क्या है. एट व्हाट एज डू दी मैक्सिलरी कैनाइन्स टिपिकली erupt? तो ये हम ऑलरेडी डिस्कस कर चुके हैं जब हमने पीछे क्रोनोलॉजी के बारे में देखा. करेक्ट आंसर वुड बी ऑप्शन सी, दैट इज 11 to 12 years of age, राइट? सो लेट्स गो टू दी नेक्स्ट क्वेश्चन. भावना थोड़ा ठहर के सोच करके फिर लिखोगे तो सारे आंसर सही हो जाएंगे, मतलब सारे क्वेश्चन सही हो जाएंगे. तो डिफरेंस यही है, आसान क्वेश्चन और मुश्किल क्वेश्चन के बीच का डिफरेंस यही है जो मैंने कल भी बताया, राइट? इफ यू रीड अ क्वेश्चन प्रॉपरली, इफ यू थिंक अबाउट इट प्रॉपरली, देन द क्वेश्चन ऑटोमेटिकली बिकम्स इजी. बट इफ यू आर इन अ हेस्ट, ठीक है ना, जल्दबाजी में जवाब देना है, तो फिर आसान क्वेश्चन भी मुश्किल हो जाएगा. तो डोंट डू दैट. ये थोड़ा थोड़ा सा गड़बड़ जो है ना, इसी से अपनी सीट रह जाती है कई बार. So what is the typical characteristic of the buccal cusp of maxillary first premolar? Typical characteristic of what? Of the maxillary फर्स्ट प्रीमोलर, तो ये फर्स्ट प्रीमोलर है, ठीक है। इसका लेट्स से कि ये बक्कल कस्प है, ये पैलेटल कस्प है, बक्कल कस्प ऑफ मैक्सिलरी फर्स्ट प्रीमोलर। द मीजियल स्लोप इज लॉन्गर, अच्छा ठीक है, तो मीजियल स्लोप is longer. This is the, let's say, mesial slope. This is the, let's say, the distal slope, right? So mesial slope is longer than distal slope. The distal slope is longer than the mesial slope. Both slopes are of equal length and the cusp is positioned lingually. So as you can see, cusp is not positioned lingually. Cusp is positioned buccal to the central axis. तो ऑप्शन डी तो वैसे ही इनकरेक्ट हो गया। एंड बोथ स्लोप्स ऑफ एनी टीथ आर, एनी टीथ कोई सा भी टूथ हो, कभी कभी भी वो सेम नहीं होती, दे आर नेवर ऑफ इक्वल लेंथ इन एनी टूथ, राइट। सो अगेन ऑप्शन सी एंड डी बोथ आर इनकरेक्ट, तो हमें ऑप्शन ए और बी में से चूज करना है। नाउ द जनरल रूल सेज दैट द डिस्टल स्लोप इज ऑलवेज लॉन्गर देन द मीजियल स्लोप, बट देन देर आर जस्ट टू एक्सेप्शंस, और ये दो एक्सेप्शन कौन से हैं? The two exceptions are upper C and upper 4. Clear? So in the upper C and upper 4, what happens is the distal slope is shorter as compared to the mesial slope. So option A is the correct answer. That is, the mesial slope is longer than the distal slope. Clear hai? Next question. Which of the following features distinguishes the maxillary first premolar from the maxillary second premolar, right? Maxillary first premolar usually has two roots, so this is the correct option, isn't it? Maxillary second premolar has a larger, has a longer buccal cusp. This is wrong, because it is the maxillary first premolar that is the largest molar. This is the largest premolar, sorry मैं molar बोल गया, this is the largest premolar, right? So option B is incorrect. The maxillary second premolar has more supplemental grooves. Yes, this is correct. Always remember that amongst the premolar, the upper 5, and amongst the molar, the upper 7, right? So upper second premolar and upper second molar, they both have more supplemental grooves, right? So they both have more supplemental grooves. So option C is correct, option A is correct. Option D says the maxillary first premolar has a more prominent mesial concavity. Yes. So mesial marginal groove which continues into mesial surface depression, right? Mesial developmental depression. Mesial developmental depression just above the CEJ. CEJ के just ऊपर शुरू होता है, क्राउन पे शुरू होता है और नीचे रूट के अंदर कंटिन्यूअस होता है, राइट? सो let's say this is the root, and then this is the crown. So the concavity starts just above the CEJ and it continues into the root, isn't it? So this is the mesial developmental depression and a unique feature of the maxillary first premolar. ठीक है? So what is the name of the groove that separates the mesiobuccal lobe from the lingual lobe in mandibular first premolar? ये क्वेश्चन थोड़ा सा इनकम्प्लीट रह गया मेरी तरफ से, so I have completed it. What is the name of the groove that separates the mesiobuccal lobe from the lingual lobe in mandibular first premolar? So let's say this is the occlusal view of the mandibular first premolar. This is the buccal cusp, and here you have a small lingual cusp, right? These are the large mesial and distal concavities. Now what happens is that, as we have discussed in the class, the buccal cusp is formed of 3 lobes, isn't it? The buccal cusp is formed of 3 lobes. Let's say this is the distal side, this is the mesial side, isn't it? And the lingual cusp is formed just of 1 lobe, right? So any tooth is formed of at least 4 lobes, 3 buccal and 1 lingual. So what the question is asking is that prove that is separating the mesiobuccal, this mesiobuccal lobe from the lingual lobe, isn't it? So we have a groove which passes here. So do you remember the name of this groove which is present on the mesial surface or on the mesial side of the lingual cusp of the lower first premolar? It is known as mesiolingual developmental groove, isn't it? It is called mesiolingual groove, or mesiolingual developmental groove, whatever you want to call it, right? So mesiolingual developmental groove, that is option C. Correct है? Let's go to the next question. अगर कुछ भी समझ में नहीं आ रहा हो, कुछ भी डाउट हो तो बेहिचक पूछें आप लोग, है ना? एंड ट्राई टू आंसर दीज क्वेश्चंस. ऐसा नहीं कि सिर्फ मैं बोलता रहूं, है ना? वेरी गुड भावना. मेसियोलिंगुअल ग्रुप, राइट. सो मैच द फॉलोइंग मैंडिबुलर प्रीमोलर फीचर्स विद देयर एसोसिएटेड रूट कैरेक्टरिस्टिक्स. सो मैंडिबुलर प्रीमोलर पे आ गए हम. इसका फर्स्ट प्रीमोलर और सेकंड प्रीमोलर और इनके रूट कैरेक्टरिस्टिक्स को हमें यहाँ पर मैच करना है. सो मैंडिबुलर फर्स्ट प्रीमोलर पहले ले लेते हैं. सिंगल रूट विद पॉसिबल बाइफर्केशन, single root with no bifurcation, prominent mesial root groove. So which one do you think has a more chance of a bifurcated root amongst the first and second premolar? Which of these two will have a higher chance of a bifurcated root? I guess it would be of the mandibular first premolar, isn't it? Mandibular second premolar, it has a single root with no bifurcation, obviously. Anyways, mandibular first and second, they both these premolars have a single root without any bifurcation. But when you look at the language of this option, a single root with possible bifurcation, it says yes, it has a single root, but there is a possibility of bifurcation, right? So that's why we'll select it for first premolar, because the chances of bifurcation are higher in first premolar. As far as the third option is concerned, do you think this describes any of the first or second premolar? Do you think it describes any of the first or second premolar? The thing is that the distal concavity is more prominent as compared to the mesial concavity. So this option is incorrect, and hence it does not describe any of the first or second premolars. So for first premolar, the answer is A, and for second premolar, it is B. Is it clear? Identify the structure marked by the arrow. Identify the structure marked by the arrow. तो ये arrow ने कुछ structure mark कर रखा है. क्या है? Let's see. Transverse ridge, oblique ridge, central groove, lingual groove. So एक बार देखने में तो ऐसा लगता है कि ये जो arrow है, it is talking about this groove, isn't it? But then do you think the name of this groove is either central groove or lingual groove? What is the name of this groove? This is known as transverse groove, and it crosses the oblique ridge, right? This is the transverse groove and it crosses the oblique ridge. Then which is the central groove? This here is the central groove, and this groove here, this is the lingual groove. So we can easily rule out option C and D, isn't it? तो बाकी grooves भी देख लेते हैं एक बार. This is the distal groove, and here you have the buccal groove, isn't it? And this is the groove of the fifth cusp. Clear hai? So these are the 6 different grooves: transverse groove, central groove, lingual groove, distal groove, buccal groove, and groove of the fifth cusp. Clear? Now, do you think this is the transverse ridge? The transverse ridge would be between mutually opposing cusps, right? So between the mesiobuccal and mesiolingual cusp, this is the transverse ridge. This is the transverse ridge. And the arrow is marking this oblique ridge. This structure is what? It is the oblique ridge. That is option B. Is it clear? क्या ये आपको सबको समझ में आ रहा है? जो इसमें अलग अलग स्ट्रक्चर्स मैंने मार्क किए हैं, राइट? ट्रांसवर्स ग्रूव, द ग्रूव दैट क्रॉसेस द ओब्लिक रिज. क्लियर? मैच द फॉलोइंग रूट्स विद देयर एसोसिएटेड कैरेक्टरिस्टिक्स. तो रूट्स को उनके कैरेक्टरिस्टिक्स के साथ मैच करना पड़ेगा. तो लिंगुअल, मीजोबक्कल, डिस्टोबक्कल, दैट मीन्स द रूट दे आर टॉकिंग अबाउट इज ऑफ maxillary molar, isn't it? They are talking about the roots of maxillary molars, right? तो lingual root का इनमें से कौन सा कैरेक्टरिस्टिक होगा? Let's check. Longest of the 3 roots, often has 2 canals, smallest and shortest root. तो lingual root का तो कौन सा हो गया कैरेक्टरिस्टिक? It is the longest of the 3 roots. It is the longest and largest of the 3 roots, isn't it? Then mesiobuccal root. So what is the characteristic of mesiobuccal root? Obviously it is shorter or smaller than the lingual root, but it is larger than the distobuccal root, isn't it? So it often has 2 canals, and it often has 2 canals. And third one is distobuccal root. So distobuccal is the smallest or the shortest root, isn't it? So these are the characteristics of these molar roots. Can you tell me which is the largest root? अगर क्वेश्चन सिंपल ऐसा ही हो, which is the largest root? And options are maxillary canine, maxillary first molar, palatal root, mandibular first molar, mesial root, and option D is lower canine. So which of these do you think is the largest root? तो ये भी हम आखिर में देखेंगे. एक पीछे क्वेश्चन और मैंने पूछा था, कुछ तो भी जो हमने डिस्कस किया था कि हम आखिर में देखेंगे. आपने अभी तक भी उसका जवाब नहीं दिया, राइट? तो वो सोच के रखो, ये वाला भी सोच के रखो, और जब खत्म होने वाला है वैसे हमारा है पेपर आज का, उसके बाद फिर हम ये डिस्कस करेंगे, राइट? Which of the following are correct regarding the differences between mandibular first and second molars? So mandibular first and second molars. The mandibular first molar has 5 cusps, whereas the second molar typically has, molar की बात है, मैं premolar लिख दिया मैंने. First and second molars. So mandibular first molar has 5 cusps and second molar has 4 cusps. तो ये तो सही है बात, right? So option A is correct. The second molar has a more rectangular occlusal outline. So first molar की outline कैसी है? First molar has more or less a pentagonal outline, isn't it? It has a pentagonal outline, whereas the second molar has a more rectangular outline, isn't it? It has a more rectangular outline. So option B is also correct. The first molar has more widely separated roots. This is also correct. Why? Because as we move posteriorly, as we move from 6 to 7 to 8, the roots become more and more converging, right? So obviously first molar has more separated roots as compared to 7, and 7 has more separated roots as compared to 8. The second molar has a distal cusp. This is false because distal cusp is present in the mandibular first molar, isn't it? Distal cusp is present in the mandibular first molar, and as you can notice it in this diagram, the distal cusp is not present on the buccal surface. It is usually present on the distal surface, and that is why it is called distal cusp and not distobuccal cusp. इसको डिस्टोबक्कल कस्प क्यों नहीं कहते? क्योंकि ये डिस्टल सरफेस पर है, बक्कल सरफेस पर नहीं होता यूजुअली. अगर ये बक्कल सरफेस पे होगा तो क्या होगा? Then the tooth would appear somewhat like this, isn't it? It would appear somewhat like this, and then its shape would be trapezoidal. Then the shape of the crown would be trapezoidal, isn't it? और ये shape कहाँ मिलती है हमको? Lower E में, isn't it? This is a typical shape of lower E. That does not mean it won't be seen in lower 6. Yes, it is seen in lower 6, but this is a lesser occurrence as compared to this distal cusp. तो डिस्टोबक्कल cusp ये क्या कहलाएगा? डिस्टोबक्कल cusp. This would be called distobuccal cusp now, since it is on the buccal surface now. But usually it is on the distal surface, and hence it is called distal cusp. Clear? In lesser cases or in lesser conditions, it would be seen on the buccal surface, where it would be called distobuccal cusp. Clear है? But primary में it is mostly seen on the buccal surface, where it is called distobuccal cusp. तो प्राइमरी में तो डिस्टोबक्कल कस्प कहलाता है, परमानेंट में डिस्टल कस्प कहलाता है. What is the overall occlusal outline of the mandibular first molar? तो अभी अभी हमने ये डिस्कस किया, और इसका आंसर क्या है? पेंटागनल, राइट? सो पेंटागनल इज द मोस्ट कॉमन आउटलाइन when we have a distal cusp. But when we have a distobuccal cusp, that is the distal cusp, instead of being on the distal surface, it is on the buccal surface, then it will be trapezoidal. And if in rare cases, the distobuccal cusp or the distal cusp is non-existent, right, or is very small, then you can have a rectangular shape. तो अगर इसके अंदर रेक्टेंगुलर भी होता, ठीक है ना, ऑप्शन ई रेक्टेंगुलर होता, ऑप्शन एफ ट्रेपेजॉइडल होता, then which option would you have selected amongst all these options? Which one you have selected? Again, since pentagonal is the most common, we would have gone with pentagonal, right? Because this is the most common outline of the occlusal surface. Clear? So next question, at what age does the transition from primary to permanent dentition typically begins? तो primary से permanent में transition begins at what age? So don't you think that the transition would begin with the eruption of the first permanent molar? Isn't it? तो आंसर दे दिया मैंने, फर्स्ट परमानेंट टूथ बोलने की जगह फर्स्ट परमानेंट मोलर बोल दिया, तो अपने आप ही आंसर आ गया, isn't it? So option C, because the first permanent molar erupts at the age of 6 to 7 years, isn't it? So option C, that is the correct answer. क्या आप सबको समझ में आ रहा है? Which part of the tooth makes contact with the opposing tooth during functional mastication? तो फंक्शनल बोलो, कुछ भी बोलो. ड्यूरिंग मैस्टिकेशन, तो मैस्टिकेशन में वो कौन सा पार्ट है टूथ का जो कि फूड को ग्राइंड करने में हेल्प करता है? इज इट द इंसाइजल एज, इज इट द लिंगुअल रिज, इज इट द सपोर्टिंग कस्प, और इज इट द मार्जिनल रिज? तो सपोर्टिंग कस्प को ही हम स्टैम्प कस्प भी कहते हैं, isn't it? So what is a stamp cusp? Stamp cusp जो कि ग्राइंड करता है बेसिकली, जो कि फूड को ग्राइंड करता है, which helps in the grinding of the food. So since the supporting cusp is the one that helps in the grinding of the food, it has to be the one that makes the contact with the opposing tooth during chewing or during mastication. Is it clear? So again the answer is option C. So this is the last question. ठीक है? So the correct answer here once again is option C, that is supporting cusp. अब हम अपने पीछे जो 2-3 क्वेश्चन हमने बात की थी उन पे चले जाते हैं. तो मैंने आपसे पूछा था विच इज द मोस्ट सिमेट्रिकल प्री मोलर एंड विच इज द मोस्ट सिमेट्रिकल मोलर. तो प्री मोलर्स की अगर हम बात करें, विच इज द मोस्ट सिमेट्रिकल प्री मोलर, इट इज द मैक्सिलरी सेकेंड premolar, though it has a wrinkled occlusal surface, that is it has numerous supplemental grooves on the occlusal surface. Still it is the most symmetrical premolar. And which is the most symmetrical molar? It is the mandibular second molar, isn't it? जो कि हमने अभी देखा. Again it has many supplemental grooves, right? फिर एक क्वेश्चन हमने पूछा था लार्जेस्ट रूट इन ह्यूमन डेंटिशन, जिसमें हमने ऑप्शन दिए थे अपर कनाइन, लोअर कनाइन, पैलेटल रूट ऑफ अपर कनाइन एंड मीजियल रूट ऑफ पैलेटल रूट ऑफ अपर मोलर, अपर फर्स्ट मोलर एंड मीजियल रूट ऑफ लोअर फर्स्ट मोलर, राइट? सो द आंसर देयर वुड बी अपर canine. This is the largest and longest root. Is it clear? तो ये उन तीनों क्वेश्चंस के आंसर. क्या किसी को कुछ पूछना है? Is there anything that you would like to ask? कोई डाउट है कुछ? कुछ पूछना है? Is there any doubt? या हम ओवर करें क्लास आज की? चलो देन मिलते हैं फिर नेक्स्ट मंथ, ठीक है? ओके देन, गुड नाइट.